Seniors, avoid this stool type. It could be a sign of cancer. Please listen very carefully to what I'm about to share with you, because this information has the potential to save your life. Each and every time you visit the bathroom, your body is attempting to send you vital messages. However, the vast majority of people simply flush the toilet and walk away, never giving a second thought to what they've left behind. They remain completely unaware that their body might be desperately signaling for help, and this oversight can have truly fatal consequences. I understand that this might sound alarming, but as Dr. Michael Kent, I have witnessed this tragic scenario unfold far too many times within my medical practice. Patients often disregard these crucial warning signs, mistakenly believing that what they are experiencing is merely normal. Then, one devastating day, they receive a cancer diagnosis, and by that point, it has often progressed too far for effective treatment to make a significant difference. Let me reveal a profound truth that almost no one discusses. Your stool is essentially a daily report card for your body, providing invaluable insights into what is truly happening within your internal systems. Its color can offer clues about the health of your liver and pancreas, or even indicate the presence of internal bleeding that you can't otherwise see. The shape of your stool can act as an early warning system, alerting you if something is obstructing your intestines, potentially even a serious growth like a tumor. What makes this even more alarming is that some of the most dangerous types of stool can appear almost completely normal at first glance. You might peer into the toilet bowl, assume everything is perfectly fine, while a life-threatening condition is quietly, insidiously growing inside you. That brief, perhaps slightly awkward moment when you glance into the toilet before flushing could, without exaggeration, genuinely save your life. Today, I am going to show you precisely what to look for. I will detail which specific types of stool are the most dangerous and explain exactly when you need to urgently run, not just walk, to the emergency room. But please understand, my primary goal is not simply to frighten you. I am also committed to providing you with practical, realistic, and actionable solutions. Simple steps you can begin implementing today to actively protect yourself. These are strategies that can offer genuine help, even if you are currently taking multiple medications, even if you have limited physical mobility, and even if you are living on a strict fixed income. Furthermore, the final two secrets I will reveal are so incredibly powerful that they could significantly improve your overall health in just a matter of weeks. First, it's imperative that you grasp a very important concept. Most people have absolutely no idea what healthy stool is actually supposed to look like. They were never taught this essential information. No one wants to talk about it because it often feels embarrassing or unpleasant, so the topic is simply ignored. This pervasive silence is, in fact, a colossal mistake with serious repercussions for public health. Allow me to explain this as simply and clearly as possible. Medical professionals commonly utilize a diagnostic tool known as the Bristol Stool Chart. You can easily find and print this chart for free online, and I strongly recommend taping it inside your bathroom cabinet for quick reference. Simply search for Bristol Stool Chart, and you'll find it with ease. This chart systematically categorizes stool into 7 distinct types, ranging from number 1 to number 7. Type number 1 typically resembles hard, separate little pellets, almost like rabbit droppings. Conversely, type number 7 is completely liquid, much like water. What you should ideally be aiming for is stool that is consistently brown in color, soft in texture, and well-formed, often similar in shape to a smooth sausage. It should never be excessively hard or overly loose, and it should pass smoothly and comfortably without any strain or discomfort. When your stool consistently exhibits these characteristics, it usually signifies that your digestive system is functioning optimally and efficiently. The characteristic brown color originates from bile, a vital substance meticulously produced by your liver. Bile initially starts out as a greenish liquid, but as it journeys through your digestive tract and interacts with enzymes, it naturally transforms into a brown hue. This consistent color change is a positive indicator that your internal processes are working exactly as they should be. You should also ideally be having a bowel movement at least once a day, or at a minimum once every other day, ideally around the same time each day to maintain regularity. If you find yourself going much less often than this, or if you suddenly notice a significant increase or decrease in your usual frequency, these are clear warning signs that your body is attempting to send you. This is where understanding the details becomes truly critical. Healthy stool should have a normal, consistent thickness, typically roughly about as thick as your thumb, or perhaps a little bit wider. If you begin to notice that your stool has become unusually thin, resembling a pencil or a flat ribbon, this could be a crucial indicator that something is physically narrowing or squeezing your intestines. This unwelcome pressure could very well be originating from an internal growth. And yes, tragically, that growth could indeed be a tumor. I am not presenting this information to scare you unnecessarily or without reason. I am telling you this because far too many people are simply unaware of this vital sign. They observe thin stool, assume they are merely constipated, and then wait, hoping the problem will simply resolve itself. Meanwhile, if cancer is the underlying cause, it continues to grow and spread every single day that passes without intervention. Therefore, if you observe pencil-thin stool more than twice within a single week, you must contact your doctor's office first thing the very next morning. Do not wait for your next routine appointment to bring this up. Clearly state that you are experiencing significant changes in your bowel movements and that you urgently need to be seen soon. Using these specific words matters as they convey the seriousness of the situation and will help ensure your concern receives prompt attention. Now, I must tell you about arguably the most dangerous type of stool you could ever encounter. If your stool ever appears black, and I mean truly black, like tar or used coffee grounds, you must stop everything you are doing and treat this as an immediate medical emergency. This particular type of stool almost always indicates significant bleeding somewhere higher up inside your digestive tract. Blood from the stomach or upper intestines turns black and takes on a tar-like consistency as it gets digested and passes through your system. This could be caused by a severe ulcer, ruptured blood vessels, or even certain types of cancer. The truly terrifying aspect is that if there has been enough blood loss to cause your stool to appear black, you may already be losing a dangerously large volume of blood, putting your life at immediate risk. If you ever see black tar-like stool, do not hesitate. Call emergency services like 911 or go to the emergency room immediately. Do not wait until the next morning, and absolutely do not wait to see if it happens again. This symptom is as serious and life-threatening as sudden chest pain. There is one important exception to be aware of. Certain medications, such as iron supplements or bismuth subsalicylate, commonly found in Pepto-Bismol, can also darken your stool. However, medication-related dark stool often appears more grayish or dull, whereas blood-related stool typically looks shiny, sticky, and distinctly tar-like. If you are ever even slightly unsure about the cause, it is always safest to proceed to the hospital and get thoroughly checked by medical professionals. Another critical danger sign to remain vigilant for is visible blood. If you notice bright red blood in your stool, on the toilet paper after wiping, or visibly in the toilet water, you need to pay close attention. Sometimes this can be caused by relatively benign conditions like hemorrhoids, which are often not serious. However, at other times, it can be a warning sign of a more grave issue, such as polyps or even cancer, and you absolutely cannot tell the difference just by looking at it yourself. If you observe a small amount of bright red blood just once, you should contact your doctor within the next few days to schedule an evaluation. If you see blood more than once, or if there is a large quantity of blood, you should call your doctor the very same day. Furthermore, if you see blood and also experience symptoms such as dizziness, unusual weakness, or extreme fatigue, this constitutes an immediate medical emergency, and you should go to the hospital right away. Do not attempt to push through it, ignore it, or delay seeking urgent medical care. Changes in how often you have bowel movements are also incredibly important indicators of your digestive health. If you experience constipation that lasts for more than 2 weeks, this definitely requires medical attention. Similarly, if you have diarrhea that persists for longer than 4 weeks, it could indicate a serious underlying problem in your intestines, such as a chronic infection, significant inflammation, parasitic infestation, or even cancer. Many people are unaware that common medications they take can also significantly affect their bowel movements. Blood pressure medications, various painkillers, antidepressants, iron supplements, and calcium supplements can all contribute to or cause constipation. If you have recently started a new medication and subsequently noticed the onset of constipation, it is crucial to inform your doctor about this change. Sometimes a simple adjustment in medication can resolve the problem entirely. Remember, never stop taking a prescribed medication on your own without consulting your doctor, but always speak up openly about any side effects you experience. Now, I want to share 5 simple yet profoundly powerful strategies you can employ to actively protect yourself. This is the very same advice I consistently give to my own patients. The first strategy is to move your body every single day. When you remain seated for extended periods, your intestines can become sluggish and less efficient. The good news is that you absolutely do not need to engage in intense, strenuous exercise to reap the benefits. Even gentle, consistent movement can make a significant difference. If you are able to walk, aim for just 10 to 20 minutes a day, whether that's inside your home, around your yard, or even walking laps in a shopping mall. If you rely on a cane or a walker, that is perfectly fine. The key is simply to keep moving. If walking is not possible for you, you can still stimulate your intestines effectively by sitting in a chair and gently lifting your legs, marching in place, performing arm circles, or slowly rocking side to side. The optimal time to engage in this activity is in the morning, shortly after breakfast, when your digestive system is naturally preparing to become active. The second secret is to stop eating highly processed junk food and start eating food that genuinely heals your gut. Highly processed foods, such as potato chips, cookies, frozen dinners, packaged snacks, hot dogs, and processed meats, inflict damage on your delicate intestinal lining and disrupt your gut microbiome. Processed meats, including bacon, sausages, and deli meats, have been scientifically linked to an increased risk of certain cancers, particularly colorectal cancer. Many people mistakenly assume that healthy food is inherently too expensive, but this is simply not true. Bananas are incredibly inexpensive. Apples are quite affordable when they are in season. Oatmeal is remarkably cheap and has a long shelf life. Carrots are among the least expensive vegetables available. Canned beans cost very little and are packed with nutrients. Eggs provide an affordable and complete protein source. Brown rice is inexpensive and a good source of fiber, and frozen vegetables are just as nutritious and beneficial as their fresh counterparts. You don't need to seek out specialty or organic foods exclusively. What you truly need is real simple food that previous generations would readily recognize as sustenance. A good rule of thumb to follow is this: if a food comes in a box or a bag and contains more than 5 ingredients that you cannot easily pronounce, it's best to avoid it. A simple, budget-friendly meal plan might include oatmeal with banana and cinnamon for breakfast, or eggs with some cooked vegetables. For lunch, you could have bean soup with carrots and onions, or a sandwich made with real chicken or turkey and plenty of fresh vegetables. Dinner could consist of baked chicken with brown rice and frozen vegetables, or fish served with a baked potato and a side salad. Healthy snacks can be fruit, raw carrots, or plain yogurt. Always remember to drink plenty of water with your meals. This way of eating often costs significantly less than a diet heavily reliant on processed foods, and your digestive system will function far, far better as a result. The third secret is to consider addressing parasites once a year. Many individuals mistakenly believe that they could not possibly have parasites, but in reality, millions of people worldwide harbor them without even knowing it. Parasites can silently steal essential nutrients from your body, cause chronic fatigue, disrupt normal bowel movements, and can ultimately lead to serious and debilitating illnesses. The good news is that treatment for common parasites is usually inexpensive, very safe, and typically involves only 1 or 2 doses of medication. You can easily ask your doctor about this during a routine annual visit. If you have pets, this consideration becomes even more critical because certain types of parasites can be transmitted from animals to humans. The fourth secret is getting a colonoscopy after age 50 or earlier if you have specific symptoms or risk factors. Most people dread the idea of a colonoscopy, especially the preparation process, but this life-saving test is paramount. Colon cancer often develops without any noticeable symptoms until it has reached an advanced stage, making early detection incredibly difficult without screening. A colonoscopy, however, can detect cancerous growths early when they are most treatable, and crucially, it can identify and remove precancerous polyps before they ever have the chance to become dangerous and malignant. In many countries, health insurance plans and government programs like Medicare for those 65 and older cover screening colonoscopies at no cost. If cost remains a concern, many hospitals frequently offer financial assistance programs to ensure access to this vital procedure. Fear should absolutely not prevent you from undergoing this screening. Most patients actually report that the preparation for the procedure is far worse than the procedure itself. The fifth and arguably most important secret is taking diligent care of your gut bacteria every single day. Your intestines are home to trillions of beneficial bacteria, collectively known as your microbiome. These microscopic allies play an indispensable role in helping you digest food, fighting off disease-causing pathogens, producing essential vitamins, and even regulating your mood and energy levels. When these crucial bacteria are healthy and in balance, your entire body reaps the benefits. Conversely, when they are damaged or thrown out of balance by factors like antibiotics, a poor diet, or illness, your overall health significantly suffers. You can actively support them by regularly consuming foods rich in probiotics, such as plain yogurt with live and active cultures, and foods that act as prebiotics, which feed your good bacteria, like bananas, apples, especially with the skin, oatmeal, onions, garlic, beans, and various whole grains. These foods are generally inexpensive and incredibly powerful tools for maintaining a healthy gut. Starting today, I urge you to make a simple but profoundly impactful habit. Take just a few seconds to look at your stool before you flush. Consider keeping a small notebook in your bathroom to jot down what you observe. Is it consistently brown, soft, and easy to pass? This seemingly simple habit can provide your doctor with invaluable information if and when something changes. Regularly ask yourself whether your bowel movements are consistent in appearance and texture, and if they pass comfortably. If they are, you are likely on the right track towards good digestive health. However, if you notice any of the critical danger signs I've discussed, such as black stool, repeated instances of bright red blood, pencil-thin stool, constipation lasting more than 2 weeks, prolonged diarrhea lasting over 4 weeks, or any sudden and persistent change that endures for more than a week, you must take immediate action and contact your doctor. Do not feel embarrassed. This is precisely what doctors are trained and prepared to discuss with you. When you call your doctor's office and feel that your concern might not be taken seriously enough, state explicitly that you are experiencing red flag symptoms and that you urgently need to be seen sooner. That specific language carries weight and can ensure you get the prompt attention you need. Your body communicates with you constantly, every single day, through your bowel movements. The real question is whether you are truly paying attention or choosing to ignore these critical warnings. Start paying attention now, because early action can genuinely save your life. Your family needs you, You deserve to stay healthy, and your life may literally depend on listening to what your body is trying to tell you. I am Dr. Michael Kent, and I implore you to take this information seriously. Every small step you take today can have a massive and lasting impact on your health tomorrow. This isn't just about preventing disease, it's about maintaining your energy, vitality, and overall quality of life as you age. Your intestines are truly the core of your body's health. When they function well, everything else in your body tends to follow suit. Your immune system strengthens, your energy levels naturally rise, your mood stabilizes, and your body can efficiently absorb all the vital nutrients it needs. Ignoring changes in your stool is akin to ignoring the warning lights on your car's dashboard. The longer you wait, the worse the underlying problem becomes, and sometimes the eventual repair becomes far more complicated, extensive, or even tragically impossible. Let's delve a little deeper into understanding some of the more subtle signs that your body might be giving you. Stool that appears unusually pale, almost clay-colored, can indicate a significant lack of bile, which might signal serious issues with your liver or gallbladder, potentially even a blockage. Greasy or floating stool that also has a foul, strong odor could point towards malabsorption problems, which are often caused by conditions like pancreatitis or celiac disease. If your stool contains visible mucus or feels particularly sticky, it might indicate inflammation within your intestines, which could be related to infections. Inflammatory bowel disease like Crohn's or ulcerative colitis or other gastrointestinal disorders. These are all early warning signs that your body provides long before severe and debilitating complications have the chance to develop, which is precisely why paying close attention and acting early can quite literally save your life. Consistency in your observations is absolutely key when monitoring your stool. When keeping your notes, ensure they are consistent. Always include the date, the general appearance, the color, and the ease of passage. Over time, you will accumulate a clear, factual record to show your doctor, making it much easier for them to identify any abnormalities early on. Think of this habit as a form of preventive health insurance that costs absolutely nothing and takes less than a minute of your time each day. If you have noticed subtle changes, perhaps slightly harder stools than usual, mild variations in color, or occasional segments that appear thinner, do not ignore them. Many people tend to dismiss these as minor temporary issues, but these small changes can very often be the earliest and most critical indicators of more serious underlying conditions that require attention. Hydration plays an incredibly significant role in maintaining optimal bowel health. Drinking an adequate amount of water throughout the day ensures that your stool remains soft and passes smoothly, effectively preventing constipation and reducing unnecessary strain on your intestines. Dehydration, conversely, can cause your stool to become harder, darker, and much more difficult to pass, which may inadvertently mask other important warning signs. Aim for at least 6 to 8 glasses of water daily, adjusting your intake based on your activity level and the climate you live in. Also, it's wise to avoid excessive caffeine and alcohol, as both can dehydrate your body and exacerbate existing intestinal issues. Dietary fiber is another absolutely essential factor for a healthy digestive system. Soluble fiber, which is found abundantly in foods like oats, beans, apples, and carrots, helps your stool retain moisture, promoting a smooth and comfortable passage. Insoluble fiber, present in whole grains, leafy green vegetables, and nuts, adds crucial bulk to your stool and keeps your intestines actively working. Balancing both types of fiber in your diet supports regular, healthy bowel movements and significantly reduces the risk of intestinal obstruction or irritation. Many people consume far too little fiber in their daily diet, which often leads to chronic constipation, straining during bowel movements, and increased pressure within the intestinal walls. These factors are known risk factors for hemorrhoids, diverticulosis, and other uncomfortable and potentially serious complications. Probiotics and prebiotics are truly crucial for maintaining a healthy and balanced gut ecosystem. The beneficial bacteria in your gut are responsible for digesting food, producing essential vitamins, and protecting you against harmful pathogens. When these good bacteria are out of balance, your entire digestive system can slow down, your immunity may decrease, and inflammation throughout your body can increase. Make an effort to incorporate foods like plain yogurt with live active cultures, kefir, bananas, garlic, onions, and beans into your diet to actively support these beneficial microorganisms. Furthermore, try to avoid unnecessary antibiotic use, as these medications can significantly disrupt this delicate balance, leaving your gut vulnerable to infections and poor nutrient absorption. Exercise, even if it's gentle, actively supports gut motility and overall digestive health. Physical activity stimulates the muscles in your intestines, helping to move stool through your system efficiently and effectively. Even light activity, such as a brisk 10-minute walk, simple stretching exercises, or chair exercises, can trigger beneficial digestive activity, preventing stagnation and reducing the likelihood of constipation-related complications. Combining regular movement with mindful eating habits, adequate hydration, and a fiber-rich diet creates a holistic and powerful strategy for a healthy digestive system that functions optimally. Regular medical checkups and screenings are yet another critical aspect of effective prevention. Colonoscopies, for example, are not solely for detecting existing cancer. They also provide your doctor with the invaluable opportunity to identify and remove precancerous polyps before they have the chance to become malignant. Other diagnostic tests, such as stool analysis, liver function tests, or advanced imaging scans, may be necessary if concerning warning signs begin to appear. Being proactive rather than simply reactive significantly increases your chances of catching serious conditions early, when they are most treatable and when the prognosis for a full recovery is highest. Let's also discuss some common lifestyle habits that unfortunately sabotage gut health. Highly processed foods, excessive sugar intake, and diets rich in unhealthy fats can all slow down digestion, cause chronic inflammation, and disrupt the delicate balance of your gut microbiome. Smoking, a particularly harmful habit, damages the intestinal lining, reduces essential blood flow to the gut, and impairs your immune system's ability to protect itself. Chronic stress is another major culprit. It can trigger significant changes in gut motility, increase stomach acid production, and contribute to conditions like irritable bowel syndrome, IBS, or exacerbate existing digestive issues. Prioritizing whole, unprocessed foods, consistently practicing stress management techniques like deep breathing exercises or meditation, and actively eliminating harmful habits can dramatically improve your digestive health and overall well-being. Now, let's consolidate everything into a list of practical, daily actions you can start implementing immediately to fortify your digestive health. 1. Observe your stool and track it daily. Make it a habit to look before you flush and note any changes. 2. Stay well hydrated. Aim for consistent and adequate water intake throughout the day. 3. Eat a fiber-rich diet. Incorporate plenty of fruits, vegetables, legumes, and whole grains into your meals. 4. Support your gut bacteria. Regularly include probiotic and prebiotic foods in your diet. 5. Move your body daily. Even if it's just for 10 to 20 minutes of gentle activity, make movement a daily priority. 6. Schedule routine screenings. Never delay reporting any abnormal findings or persistent symptoms to your doctor. 7. Reduce harmful habits and manage stress. Cut back on processed foods, excessive sugar, and actively practice stress management techniques. By consistently implementing these 7 steps, you create a robust preventive framework that will diligently protect your digestive system, enhance your overall health, and contribute significantly to your longevity. The most important point I want to leave you with is this: your body is communicating with you constantly, without fail. Your stool is one of its most reliable and honest indicators of internal health, yet it is often overlooked or dismissed simply because it's considered an uncomfortable or embarrassing topic to discuss. By consciously learning to observe, accurately record, and deeply understand these signals, you empower yourself with knowledge that can prevent serious diseases, detect problems at their earliest stages, and allow you to take proactive control of your own health journey. Do not ignore these signals, thinking they are trivial or unimportant. They are your body's sophisticated way of giving you advance notice that something may be amiss. Acting early saves lives, prevents immense suffering, and allows you to maintain a higher quality of life for many years to come. Every single habit you adopt, tracking your bowel movements, maintaining optimal hydration, eating a gut-friendly diet, exercising daily, taking care of your beneficial gut bacteria, and staying proactive with medical care, compounds over time, building remarkable resilience in your digestive system and providing an invaluable early warning system for more serious conditions. When you start seeing the tangible results, more regular bowel movements, improved digestion, increased energy, and even a better mood, you will truly understand the incredible, far-reaching impact of what may initially seem like small changes. This is the very essence of preventive medicine, identifying potential risks early and making actionable, informed choices to avert serious consequences before they ever occur. Remember these critical red flags: black, tar-like stool, repeated instances of bright red blood in or on your stool, consistently pencil-thin stool, constipation, lasting more than 2 weeks, diarrhea for more than 4 weeks, or any sudden, persistent, and unexplained change in your bowel habits. These are definitive signals to act immediately. Never wait, never hope it will simply pass, and never feel embarrassed. These are critical red flag symptoms that absolutely require prompt medical attention from a qualified professional. When you speak with your doctor, being specific about your observations and providing a detailed record empowers them to act quickly and accurately, which could literally make the difference between life and death. As you adopt these vital practices, please involve your family, especially children and grandchildren, in understanding healthy habits. Encourage them to eat real, whole foods, maintain proper hydration, stay physically active, and recognize the profound importance of gut health. By doing so, you are not only protecting your own health, but you are also actively creating a culture of wellness and informed self-care for the people you love most. This collective awareness and early intervention can prevent unnecessary suffering, significantly improve overall quality of life, and potentially extend lifespan for everyone. In conclusion, your bowel movements are a daily, ongoing conversation your body is consistently trying to have with you. You possess the inherent power to listen, understand, and act by paying careful attention to the color, consistency, frequency, and any changes in your stool. By maintaining a diet that actively nourishes your gut, keeping physically active, supporting your beneficial gut bacteria, staying adequately hydrated, and diligently following up with medical professionals for routine screenings, and whenever concerns arise, you give yourself the very best chance to prevent serious diseases and maintain optimal health throughout your life. Do not wait for a crisis to force you into action. Start today and commit to making these vital habits an integral and cherished part of your daily life. Your health, your family, and your future all depend on it. Take control now, because your body has been talking to you all along, and now is the time to truly listen.